Hello, welcome to my YouTube channel. I am Dr. Payne. Today I want to discuss about low back pain. This is a model of a human lumbar skeleton. In this model, I want to show you the parts. This is the first lumbar bone, the second lumbar bone, the third lumbar bone, fourth lumbar bone, and fifth lumbar vertebra. In between each vertebra or backbone is what we call the disc. The disc is not a solid material, it's a little bit flexible, and that's why people can bend forward or backward. It allows for movement. The backbone actually protects the spinal cord, which passes through from the cervical down to the lumbar backbone. So this yellow material inside is what we call the spinal cord. We can see that the spinal cord gives out branches, the nerve branches. We call it the nerve roots. So this takes message from the brain down to every part of our body, from the waist down to the leg. So backbone is caused. There are different causes of backbone, as we can see, because the back contains different things. In generating backbone pain, it could be a disease of the bone, it could be a disease of the nerve, it could be caused from the ligament or the ligamental flavum inside that covers the spinal cord, or it could be from the muscles around the back. When there's you can see these nerve roots, they are free. They don't like anything touching them. They don't like anything compressing them. They don't like anything pressing them. They like moving freely. As I said, the disc is not a solid component of this backbone. So this disc can shift, it can lose alignment, so that when it's losing alignment, it could be anteriorly, of which it causes not much problem. But if it is towards the back, around where the nerves comes out from to move, it could compress on this nerve, giving the patient pain. When you can see this other disc has come out more than it should. So it's called disc prolapse or disc bulge. So it will give the patient pain. It could be from inflammation of the ligament inside or ligamentum unfolding. So when the ligament takes up more space than it should, it will compress the spinal canal, leading to what we call canal stenosis. It could be from degenerative changes of the spine itself, the bone will start disintegrating, start aging. But nature has a beautiful way of healing these bones by forming new bones. In the formation of this new bone, there could be overgrowth of this new bone, so that it will be compressing on these nerve roots. When there's overgrowth of this new bone, it will lead to what we call osteophytes. So the bones are not as smooth as they should be. The pain too could be from fracture of the spine, like in trauma accidents. In aging process too, there's this joint, this tiny joint, this line is called the facet joint. If there's facet joint atrophy, that's aging, disease of this facet joint, it could lead to low back pain, especially in the elderly. How does a patient know that she or he has a low back pain? It could present in so many ways. Some patients will tell you that they find it difficult standing for a long time, or walking a considerable distance, or the pain could be localized just at the back, or it could be going down the legs, or one leg or both. When there's low back pain, we do interventional management for these patients. This could be in form of lumbar selective nerve root block, or lumbar facet block, lumbar rami communicans block, lumbar sympathetic block, sacroiliac joint block, caudal epidural block. This low back pain, if not treated, could prolong to cause weakness of both lower limbs, that's both legs, or even inability to move the legs too, which will make the person not to be able to move. Thank you.